A complete physical examination must include a thorough assessment of the thorax and lungs. It informs the nurse about the movement of air and gas exchange in the patient's body, which is critical for developing correct differential diagnosis. With that, I, Pia Gwennicole Rocolas from BSN 111H, will be now performing the procedure with the thorax assessment. So let's proceed for the pre-introductory phase. Step 1. Review the client's previous medical report if available and the doctor's sheet if available. This is done to determine the patient's ability to cooperate with the assessment and the patient's diagnosis. Now, determine the scope of assessment needed and prepare the necessary equipment. Organization of the equipment prior to the procedure promotes efficient time management. So I already have here the stethoscope, the skin marker, and also I also have here a alcohol. Now, perform hand washing and don gloves if necessary. This is done to deter the spread of microorganisms. So I already performed a hand washing, as you can see here. Now let's proceed for the introductory phase. Now greet the client politely and client's companion if around. This is done to make them feel at ease and less frightened. Introduce yourself and verify the client's identity using the agency protocol. Introducing yourself to the client forms the basis of the patient and nurse relationship, and verifying the client's identity ensures that we are providing care to the right person. Ask how the client would like to be called during the assessment and establish rapport with the client. Now after that, explain the procedure to the client and how he or she can participate during the assessment. Provide the clients the opportunity to clarify, ask or raise any concerns. This is to prompt cooperation to the client. Good day, ma'am. How are you today?
I'm fine.
Okay, so that's good to hear. So I am Pia Gwennicole Rocolas from Davao Doctors College, and may I see your wristband, ma'am? And can you please state me your full name and date of birth?
Joe Victoria R. Olivar, February 27, 2008.
So how would you like me to call you, ma'am?
Joe.
Okay, Joe, so for today, I will be doing a thorax assessment, which means I need you to ask to stand up, sit down, and to take your shirt because I'll be providing a gown that you will be wearing, okay? So, and of course, to palpate or touch your upper extremities. Would that be okay with you, Joe?
Yes.
Okay, thank you, no? So, okay, do you have any questions or any clarifications before we proceed to the assessment?
None.
Okay, so you don't have to worry about the information I will be gathering today because those information will only be available to your healthcare provider, including me, okay? Now, ensure the client's comfort, privacy, and confidentiality to maintain the client's dignity. Assure the assessment setting is safe, secured, and free from distractions, and position the client in a comfortable setting position. In women, drape the anterior thorax when it is not being examined. This is to ensure the safety and comfort of our client. Will that be alright, ma'am, if I close the door? Okay, so thank you. So this is done so that no one from the outside will disturb you while the assessment is ongoing, okay? So, is the temperature alright, ma'am? Are you comfortable, ma'am?
Yes.
Okay, John, so are you ready? Okay, so we'll now start. Okay, John, so you can now take off your shirt and wear this gown. So I will be back after you're done wearing your gown, okay? Okay. We will now proceed with the survey for the client's chest and respiration. Check for signs of respiratory distress or problems with breathing. Observe the color of the face, lips, chest, and fingernails. This is done to prevent further complications in the body. Okay, Jode, are you experiencing shortness of breath, difficulty of breathing, or chest pain?
No.
Okay. So I'm just checking for your face, lips, your chest. Is it fine? And may I I see your fingers, Joe. Okay, so thank you so much. Now, palpate the suprasternal notch and note for the position of the trachea. Okay, Joe, I'm going to touch some parts of your lower neck. Is it okay for you?
Yes.
So specifically the suprasternal notch and the trachea. So, okay. We will now examine the posterior thorax and lungs. While the client stands with arm at the sides, stand behind the client and observe the position of the scapulae and the shape and configuration of the chest wall. This is done to examine the configuration of the thorax and lungs of the client. Okay, Joe, can you please stand up for me? And then can you please face over there while your arms at the side. Okay, so I'm just checking Joe, okay? Next, from lateral position, observe the three normal curvatures, specifically the cervical, thoracic, and lumbar. Then assess for lateral deviation of the spine by observing the client from the rear. Have the client bend forward at the waist level and observe from behind. This is done to inspect the alignment of the spine from deformities. Okay, Joe, can you please bend forward? So I'll just move it, okay? So I am just looking for any deviation or abnormal deformities of your spine which you don't have, so you can now stand. Thank you so much. Next, we will palpate the posterior thorax, assess the temperature and integrity of all chest skin. Then palpate all thorax areas for bulges, tenderness, or abnormal movements. Pay special attention to patients who have respiratory complaints. Okay, Joe, so can you please sit down here? Then you can face over there. Okay, so I'm just going to adjust my camera also. Okay. So far, temperature is in good condition. Also no abnormal movements, so you can say if it hurts somewhere, okay? We will now palpate the posterior thorax for respiratory excursion. Place the palm of both of your hands over the lower thorax with your thumbs adjacent to the spine and your fingers stretched laterally. Then ask the client to take a deep breath while you observe the movement of your hands and any given leg movement. Again, this is done to palpate the posterior thorax for respiratory excursion. Okay, Joe, so I'm going to put my palms here. Okay, can you please take a deep breath? Inhale. Exhale. Again. Inhale. Exhale. Again. Inhale. Exhale. Okay, thank you. Next is to place the palmar surfaces of your fingertips or the ulnar aspect of your hand or closed first on the posterior thorax, starting near the apex of the lungs. Ask the client to repeat such words as blue moon or 1, 2, 3. Then repeat the 2 steps, moving your hands sequentially to the base of the lungs. Start toward the midline at the level of the left scapula over the apex of the left lung and move your hand left to the right, comparing findings bilaterally. Move symmetrically downward and out to cover lateral portions of the lungs at the bases. After that, compare the firmitus on both lungs and between the apex of the base of each lung, using either one hand and moving it from one side of the client to the corresponding area on the other side or using 2 hands. that are placed simultaneously on the corresponding areas of each side of the thorax. This is done to palpate the thorax of for vocal tactile firmitas rather, the faintly perceptible vibration. Okay, Joe, next I'm going to do is I'm gonna put my hand at your back, and then as I touch your back, you're going to count from 1, 2, 3, and as I put it several times, you also count, okay? So can you position here, face over there? Okay, and can you not bend? Okay, so count.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, thank you so much. We will now proceed to percuss the posterior thorax to determine whether underlying structures are fluid-filled, gas-filled, or solid. Ask the client to bend the head and fold the arms forward across the chest. Then percuss in the intercostal spaces at about 5 cm or 2-inch intervals in a systematic sequence. After that, compare one side of the lung with the other, and then percuss the lateral thorax every few inches, starting at the axial and working down to the A rib. Okay, Joe, I need you to cross your arm like that, and then bend forward your head a little. Okay, so I'll just move. Okay, Joe, I'm going to percuss it now. Okay, after percussing the posterior thorax, we will now measure the diaphragmatic excursion. This is important for the diagnosis and follow-up of various physiologic and pathologic conditions. Use percussion to identify the level of the diaphragm and measure diaphragmatic excursion. Percuss downwards from above the expected level of diaphragmatic dullness until dullness is definitely here. Then mark the level of full expiration after gaining the patient's permission for the marking. Have the patient inhale deeply and hold it in. Then, percuss downward the level of dullness and full inspiration and mark it. Repeat this process on the other side. Measure the distance between the expiratory and inspiratory level of dullness. Okay, Joe, next we're going to do is you're going to inhale and hold it for me while I pat your body, okay? And then I'm going to put some marker if I hear the dullness, okay? Joe? Okay. So can you please inhale? Hold it for me. Okay. Inhale, exhale rather. Inhale. Thank you so much, Joe. We will now auscultate for breath sounds. This is done to determine abnormal breathing sounds such as crackles, wheezes, and pleural rub. Place the diaphragm of the stethoscope firmly and directly on the posterior chest wall at the apex of the lungs at C7. Then ask the client to breathe deeply through the mouth for each area of auscultation or each placement of the stethoscope. Compare the findings at each point with the corresponding point on the opposite side of the thorax. Note the location on the chest wall where adventitious sounds are heard, as well as the location such as sounds within the respiratory cycle. Okay, Joe, now I'm going to listen or check for the breath sounds of you, okay? And I need you to inhale and exhale with your mouth open. Joe, I'm going to listen and check for your breath sounds, and I need you to inhale and exhale while your mouth with your mouth open, okay? Okay. Okay, Joe. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay, thank you so much, Joe. We will now auscultate for voice sounds. We will follow the same pattern as the previous procedure, but we will ask the patient to repeat specific phrases. This is to determine abnormal breathing sounds in the body. We will now check for bronchophony sounds. Ask the client to repeat the phrase 99 while auscultating the chest wall. To check egophony sounds, ask the client to repeat the letter E while listening over the chest wall. Lastly, to listen for whispered pectoriloquy, ask the client to whisper the phrase 1, 2, 3 while auscultating the chest wall. Okay, Joe, next we're going to do is to perform the same like we did a while ago. For this, can you please say the phrase 99, okay? 99 first. Say 9. Please say 99.
99, 99, 99, 99, 99, 99.
Okay, so can you say E for me and repeat it?
E, 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 E.
Okay, and can you please count from 1, 2, 3? Okay.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, thank you so much, Joe. Okay, that is all for assessing the client's posterior thorax. We will now proceed with the assessing for the client's anterior thorax. First, inspect breathing patterns, then inspect the costal angle or angle formed by the intersection of the costal margins and the angle at which the ribs enter the spine. Joe, next I'm going to assess is in front of your chest, and what I want you to do is to lay down, okay? Okay, so you can lay down here. Okay, and you can use this blanket. Okay, Joe, so can I please move this down? Is it okay for you?
Yes.
Okay. So, I'm just going to inspect your breathing pattern and costal angle, okay? We will now proceed to our next step, which is palpating for the anterior thorax. This is to determine the tenderness, sensation, surfaces, masses, and crepitus and such. Using your fingers, palpate for tenderness and sensation. Start palpating with your hand positioned over the left clavicle, over the apex of the left lung, and move your hand left to the right, comparing findings bilaterally. Then move your hand systematically downward toward the midline at the level of the breast and outward at the base to include the lateral aspect of the lung. Repeat the sequence in palpating for crepitus and fremitus in the anterior thorax. Okay, Job, I'm going to palpate now, so you need to tell me if it hurts anywhere, okay? Okay, so permission, touch your body. You need to tell me if it hurts anywhere. Okay, so to palpate for the respiratory excursion, place the palms of both of your hands on the lower thorax with your fingers laterally along the lower rib cage and your thumbs along the costal margins. Then ask the client to take a deep breath while you observe the movement of your hands. This is done to determine if the patient has breathing problems. Okay, Jode, I'm going to palpate or touch in your lower chest using my palms and my fingers along the lower rib cage. And you have to take a deep breath, okay?
Sure.
Okay, so inhale, exhale, inhale, exhale, inhale, exhale. Okay, thank you so much, Jode. We will now proceed to percuss the anterior thorax systematically. Begin percussing above the clavicles in the supraclavicular space and proceed downward to the diaphragm. Then, compare the lung on the other side to the lung on the other side. Displace the female breasts to facilitate percussion of the lungs. Okay, Jode, now I'm going to percuss in front of your chest, okay?
Okay.
Okay. I'm going to up this. Okay, thank you so much, Jode. Okay, now we will going to auscultate for anterior breath sounds, adventitious breath sounds, and voice sounds. This is done to determine abnormal breathing sounds. And first, auscultate the trachea. So I'm going to use a stethoscope here. Okay, Jode, I'm going to listen for your breath sounds. Okay, first in your trachea. Okay, thank you so much, Jode. After auscultating the trachea, we will now auscultate the anterior thorax. Place the diaphragm of the stethoscope firmly and directly on the anterior chest wall. Then auscultate from the apices of the lungs, slightly above the clavicles to the bases of the lungs at the sixth rib. Follow the sequence of the anterior chest auscultation. Ask the client to breathe deeply through the mouth in an effort to avoid transmission of sounds that may occur with nasal breathing. Then, listen at each side for at least one complete respiratory cycle. Listen for normal breath sound and adventitious breath sounds. Follow the systematic ladder pattern. Okay, Jode, next we're going to do is you have to inhale and exhale with your mouth open because I'm going to listen for the normal breath sounds and adventitious breath sounds, okay? Okay. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Okay. Inhale, exhale, 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 and inhale, exhale. Okay, thank you so much, Jode. Summarize the information obtained during the working phase and discuss findings to the client. Discuss to the client possible plans to resolve health concerns if present. This is done to help establish the patient's goals for therapy, allow for more insights into their progress, and establish a better therapeutic alliance. After that, assess the client's understanding of the plan and the need for further teaching. Provide the client with the opportunity to ask or raise any concerns, and this is done to improve patient's satisfaction. After that, thank the client and end the interview politely. This is done to strengthen the patient-nurse relationship, and do not forget to perform hand washing to deter the spread of microorganisms. Okay, Joe, now I'm going to sum up everything that we took up earlier, okay? So, your spine is vertically aligned and straight, so while palpating for your anterior and posterior thorax, your skin is intact and the temperature is normal, and your tenderness or masses is normal as well. So, while I was listening to your breath sounds, it was also normal. Your breathing pattern is quiet, rhythmic, and effortlessly respire. Basically, everything is normal, so just continue keeping your body healthy, okay? Eat healthy foods, get regular exercise, and keep up with yearly health checkups, okay? So, do you have any concerns, questions, or any clarifications before we end? Okay, thank you so much. So, thank you so much, Jode, for your amazing cooperation, and have a great day ahead, okay? Document findings in the client record using printed or electronic forms or checklists supplemented by narrative notes when appropriate. Documentation is done to create effective communication between the healthcare team. And that is all for my return demonstration in assessing the thorax. Thank you for watching, and may God bless us always.